Yeah, hi, Graeme Clarke, clinical psychologist. I'd like to talk to you about a model of couples therapy called emotionally focused couples therapy. I've been learning the model and using it with couples over the last few years and found it to be really positive, has a lot of depth, and just like to pass my take on the model and just some resource material if you want to pursue this further. I've been seeing couples on and off for 35 years, and traditionally there are a range of approaches that couples report to be really helpful, like working on their communication skills and the roles within the relationship, quality time together, conflict resolution. All these approaches couples report to be helpful. But they also often say that something is still missing. They're not quite reaching each other in the way that they would like to, or old stuff tends to come up and not be resolved. And this model appears to address those issues. So the model was championed by a lady called Sue Johnson, who's a clinical psychologist. And Sue's written a couple of books. One's called Hold Me Tight. The other is called Love Sense. And there's a lot of really good information in these books, lots of anecdotes that couples can relate to, and just tips on ways of just managing different things that come up. Sue also reflects on the science of the model, and the science is really sound. This model is as effective as any couples therapy. 70 to 75% of couples report benefits, that they understand each other better or communicate more effectively, or when the going gets tough, they seem to move through it more easily. And couples that pick up this way of communicating that the model encourages tend to continue with being able to do that, so it endures. So really impressive data. There's also ways of measuring when couples move into this sort of positive, open way of communicating. So if we were looking at a couple that were doing that, they would be open emotionally. So rather than being really defensive, they would be attentive and more open. They'd be making moves to acknowledge and just sort of comfort their partner in some way, and they'd be present. So they'd be just remaining engaged with them. And so when a couple communicate in this way, it's like it really helps them feel as if they are being understood or acknowledged. And of course, we communicate in a whole range of ways. There are many things that we do and say during a day, but this is really at times that couples feel that they really do need each other. They have this capacity to move into this attachment way of connecting. There are many stages and steps in the model, but I just want to focus on a couple that really reflect the essence of the model. So when we meet a couple, we really try and get an understanding of what's going on for them and the issues that are really important for them. And then what we do is we try and encourage them to look at the times when they're not connecting and they're trying to connect and it's not happening. And the research is also really clear that at these times, couples move into cycles or patterns that repeat and become incredibly difficult to get out of. They're really unhelpful and, often very destructive, but it's like the only thing that couples know what to do. And so we really encourage the couple to look at what's happening during these times. Sue Johnson uses a lovely metaphor about a tango dance, so that when we are in sync, we're there for each other's moves and we're mirroring, and even though it might not be perfect, we're trying to reach. And when that's not happening, when we're moving into this negative dance, it's not pretty to watch. It's very uncomfortable and there's movements all over the place, but there's certainly not that reaching for each other in a way that's helpful. There are several common negative dances, and each involves a pursuer or a withdrawer, so there can be two pursuers or two withdrawers. Very commonly there's a pursuer and a withdrawer, and many couples can relate to this negative dance. So if I was triggered and I was a pursuer, what you would probably be seeing and feeling is someone that is feeling overwhelmed, extremely distressed, really desperately trying to reach their partner, so they would become across as negative and critical, and just extremely distressed because they're not able to reach this person that they really want to. Now, if I was the withdrawer, I'd be hearing this and going into my shell. I'd be like a tortoise. I'd be trying to escape, probably move to another room. So these are the moves in this pursuing withdrawing dance. And we help couples to really understand what their moves are. We also look at the triggers, and there can be a range of triggers, a look, something said, a move, and boom, the couple move into the cycle. There can be many things contributing to the triggers too. We all know when we're tired and overwhelmed and overstressed, those triggers can be intensified a wee bit more. Or if there are sort of major stresses, we have something happen in our lives like an illness or a change in job or house, or the loss of someone close to us. There are times that couples really need each other, and the triggers can intensify during those times. There's also sometimes issues from the past, and it may be, something that's happened to the relationship, and this comes into the dance. We call this an attachment injury because from that ability to connect and attach, this really makes it very hard for that to happen. There can be older injuries too, going way back where issues of trust are really difficult, and so it's really helpful to just understand those issues and how they impact on the relationship. So what we do is we really help a couple see this dance as being the enemy. It's moving them away from a way of communicating that's helpful. They get really good at picking each other's moves, so not only what they're feeling and doing, but actually what happens to their partners. So when one says or does something, the other reacts in a certain way, then that triggers another reaction in the partner, and then another move, and so this dance plays out. But what's really great is that a couple get really good at being able to pick their triggers and pick their dance moves. So they have a measure of control, and the stress begins to go out of, what is associated with this dance, because it's such an uncomfortable place to be in. It's a really sensitive area, and couples report great distress each time they move into this cycle. The second part that we look at when we're we've addressed the cycle and helping the couple to do that, we're also looking at all the emotions within the cycle, but also beneath the cycle. And this is where the model gets its name. It's emotionally focused couple therapy. So we're looking at all the emotions. We all, of course, think about things and we frame them and we problem solve and we look at our solutions, and all those ways of processing information are just as important. We need to work out how we do things. But given what happens in the cycle is really very emotional, we need to really help a couple work out what those feelings are and what is often going on beneath the cycle. And this comes back to this attachment frame and really beautifully explains what is actually often going on beneath the cycle, because the research is very clear that if we want someone to be there for us, if we want to be understood, if we want to be validated, or we want to be comforted, this person that's number one in our lives, and it's not happening, we will respond in a way that often is very clear when we just move below the cycle. So couples will report often feeling just really distressed, very anxious. For instance, the pursuer, when we just slow things down and get them to identify what they might be feeling beneath the cycle, they will talk about being distressed, anxious, often really fearful. They'll also have different thoughts and other feelings, almost feeling alone or abandoned. And this makes perfect sense when we're looking at this attachment model, because we want that person to be there for us. We're not. So this is incredibly distressing when that is happening. And for the withdrawer, they will often report, look, I really feel I've been working hard to do my best, do all the things that might be helpful, but again, I'm failing, and so I'm not feeling great, and what's important is that, you let me know that I'm actually doing okay. So they begin to just really report what they're feeling as well, which is incredibly distressing because the person that they care for is not validating them in some way that's helpful. They're just feeling criticized. So we help the couple then to just identify these feelings, and this opens just a range of options for the couple. And this moves us into the next stage, which is working on the ability to communicate from a place that's a genuine need and gives the partner a clear signal about how important they are in the relationship. So when a couple can get away from that cycle where there's often a sense of sort of blame and never feeling good enough, so it's always based on sort of a defense and the sort of negative feelings associated with that. When the couple can slow that down and change that, and then come from this place where they are much more transparent about what they're feeling in relation to the partner not being there and really wanting them to be there, this allows them a window of communication that's incredibly helpful. So the pursuer might say, look, when you shift away, I am feeling distressed, and I am actually feeling alone because I need you there with me. And so can you just sort of stay there and listen to what I'm saying? Now that's a very different message from being critical or negative, and it's coming from a place that is very genuine in terms of how important this person is in their lives. And the withdrawer might say, look, when you raise your voice and you begin to get angry, I am beginning to feel distressed too, because I'm just feeling I'm failing again. And I really need to hear from you that I am okay. You are really important to me. So the couples begin to just gradually communicate in this way. And it does take considerable time because it takes a lot of courage to reach into those feelings, but they make a lot of sense, but once a couple begin to do this and they can share and slow down and reach each other and feel as if they have the trust to do that, it's a really beautiful thing to experience, and couples just gradually slowly get better at doing this. Couples will often show concern. They say, look, it is really good to understand that I'm coming from this place where I'm aware of what's happening with my partner isn't there for me, and what I'm feeling, because that's much better than the sort of that cycle that was so negative and so distressing. But I don't know if I can communicate in that way. It does seem a bit hard. Well, look, it's really the really good news is, just as we're wired to experience comfort, we're very deeply wired to give it. And couples will often just reflect on time they've felt more relaxed and so more safe to communicate in this way. And as they begin to get the cycle understood, and as the trust builds to share feelings in this way, they really get more confident at doing this. I also encourage couples, if they have children, to reflect on what they do if their children are distressed, and it's exactly the same move and stance that we get into. So we hopefully aim to be there and understanding what our children are going through. We attend to whatever their moves are, and we aim to just acknowledge and comfort them in some way. So that resource, when there's safety, is definitely there, and couples just learn to do that. Couples sometimes also report that they have concerns, look, will this make us more or too dependent on each other? I need to be independent and strong. Well, again, the research is very clear, and again, it makes sense that if we feel good about knowing that we can be there at times that are really tough, and our partners can also reach in a way that's constructive when things get going tough, it strengthens the relationship, but it also strengthens us. We still have all the things that we'd like to do in life as individuals, all the challenges we have. It takes nothing away from that, but it often strengthens our resolve to do that, because we feel we have this skill in the relationship. There's also the flow-on effect to the relationship, that things that are always there, all the challenges for our time and the just all the stuff we've got to go through. There's always going to be differences and slight level of conflict, but those issues tend to soften when a couple can more and more understand and communicate in this way. So, yeah, really good approach to learn. Couples, when I've seen them and reflect back on what's been helpful, they say, look, it's when we really got that cycle. And look, it isn't easy, because there's an incredible amount of sensitivity with that cycle. A really deep hurt, a range of really difficult feelings at times, like almost feeling guilt or shame, but feeling alone. All those things come in, and because the cycle, that lives this life of its own, and it's the only thing that the couple have really understood. But yeah, when they begin to see it for what it is and get that confidence to sort of feel they can share things in a way that's positive and trusting, it begins to shift. And this is what couples say, and it is great to watch when that happens. Just very briefly, with some issues, there would need to be a thorough assessment. This may be, for instance, where there's domestic violence. So clearly what is paramount is that there is safety in the relationship. So if that's going on, although that might be workable with the model, there definitely need to be a sort of thorough assessment to see if any other resources or supports may be necessary. Also, if there's a mental health issue, an addiction, an extreme addiction, alcohol, substance, sexual addiction that really intrudes in quite an extensive way, or a mental health issue like a severe depression. And here I'm talking, where someone has great difficulty feeling any joy at all and has low energy. Sometimes there's postpartum depression, where a woman has given birth and then goes through these endogenous symptoms, or there may be generalized anxiety someone's experiencing that is very intrusive in their life. When those issues are going on, definitely see the GP and look at an assessment, because there's many options for help with those issues, and then look at how the relationship can be workable. But with most areas, this model can apply for couples. We all go through ups and downs and stresses and mood changes. Those things tend to improve a bit when we're communicating more effectively. The model is really good for trauma. In trauma, we may get re-experiencing of the event, avoidance, heightened anxiety, and again, the model is helpful because it helps the couple understand where this might come in to the ability to hear each other and connect, and it really just helps address that. So if you feel this may be helpful, look at those books. There are lots of other books available too, videos available. There's also websites, the Emotional Focus Therapy website, for instance, in New Zealand, and it lists people who are trained in this area. There's also Hold Me Tight workshops, which are couple workshops. Great to share with other couples because we all do go through the same thing. So yeah, look, I hope that's been useful. It's really distressing when couples get into cycles that they just can't see any other options. And it does take a bit to really work through and change that. But the research is clear that given there's a will, there's a way of being able to shift that and look at this other way of communicating. It just opens that up, and it's really helpful to look at as an option. So yeah, all the best with that. Cheers.